Dear friends, I'm Dr. Bose, the founder of SANS Foundation. Today, I will be discussing another very common problem which we are handling is interstitial lung fibrosis, or in simple, what you call lung fibrosis. Though we have been handling lung fibrosis plenty in our clinical practices, but after COVID, this disease has taken a very important place. Many of the people, those who have not been adequately treated during COVID times, they have developed some lung manifestations. Now, what exactly is this interstitial lung fibrosis or lung fibrosis? Now, what happens? Our lungs have thousands and millions of balloon like structures called alveoli. And if every alveolus is a functional unit of the lung, every alveolus bring oxygenation to a system, but the surface of the alveolus or the space between alveolus and the capillary system, the area from where the oxygen gets into the circulation system, they get into a little thickening. It's an autoimmune changes, it's post-viral changes. And this thickening creates a kind of alveolo-capillary block. That means the lungs are getting oxygenation, but they are not able to reach the blood supply. Though interstitial lung fibrosis, if we know since ages, the majority of the cause of interstitial is not known. It's called idiopathic. There are few percentage that could be because of autoimmune disease like rheumatoid arthritis, other collagen disorders, drug-induced, occupational exposures, birds like pigeons, etc. But in post-COVID scenario, we are getting entirely a different picture. Here, the interstitial fibrosis is a little softer, and they are responding to the treatment. Many of our patients who had significant lung inflammation or what you call interstitial pneumonitis, when they were treated with these good drugs like pirfenidone and nintedanib, they showed a significant response. But still, with an adequate treatment, like in the form of optimum steroids, nintedanib, pirfenidone, even we have colchicine, sometimes this lung fibrosis becomes protracted, it progresses. And many of the patients which we are receiving on a daily basis, they have been adequately treated, but their fibrosis is still persisting. Many of them are progressive, some are little static, but they are continuously coughing, they are very deconditioned. And one of the commonest problems which I'm finding in my patients is that they have a lot of steroid manifestation, what you call steroid myopathy, steroid bloating, steroid water retention, nutritional problems, and all those things. So, dear friends, if you really want to do well on lung fibrosis, if any one of your near and dear ones are having these problems, the answer is a good pulmonary rehabilitation. At SANS Foundation, we run a very structured lung rehabilitation program in interstitial lung fibrosis, where we reduce the steroids, improve the muscle mass, we work on breathing techniques, nutrition is very important areas, specific structure, high intensity repeated exercises we give. And many of my patients, in fact, this number of patients are increasing in my clinical practice. A good chunk of the patients have showed significant reversibility. They improve their mental health, they improve their physical health, and the best part of it, the quality of life is improving. Their oxygen, endurance is increasing. Their requirement is oxygen also coming down. And many of these patients are out of their oxygenation and steroidal system. So, dear friends, pulmonary rehabilitation is structured pulmonary rehabilitation or SANS pulmonary rehabilitation is a very interesting holistic program where our therapist, psychologist, nutritionist, myself, whole team works very passionately with our patients. And a good chunk of our patients are showing reversibility and what we call the reversal of chronic disease. So, friends, if your near and dear ones are having these issues in the post-COVID time or otherwise, please reach us, contact us. We are probably able to help you. Take care. Regards, Dr. Bose.